Well, several days this week, the U.S. broke coronavirus death records. Thursday was no different. More than 4,000 Americans died Thursday. That is not only a record for the U.S., but for the world. At this pace, one person in the country is dying every 21 seconds. And new research is out proving why it is so important to continue following those safety measures like wearing that mask, social distancing from others. The CDC says that people without symptoms are behind more than half of all reported cases in the U.S. So for more on this, I want to bring in Dr. Bob Lahita. He's a professor of medicine at the New York Medical College and chairman of medicine at St. Joseph University Hospital. Thank you so much, doctor. So as I was reading that, I was thinking about a video that went viral where there was a woman who wasn't wearing a mask, and she kept on insisting that it was proven that if you didn't have symptoms, you could not spread the coronavirus. And I just thought, where did you get that misinformation from? And she felt that putting a mask on was too much to ask her. And so here we know that that's certainly not the case. So the CDC says on top of headaches, fevers, other side effects being reported after people receive the coronavirus vaccine, there are some cases of anaphylaxis. We kind of heard about that pretty early on, which is a severe allergic reaction. As I understand it, you are on schedule to get the second dose of the vaccine later on today.
Yes, I am.
take it you didn't have any side effects. Can you tell us more about what we're hearing and whether or not Americans should be worried? Because you don't look very worried.
No, I'm not worried at all. I mean, no one is worried who works in intensive care and works in the hospital and sees the countless numbers of patients and countless numbers of people who succumb to this terrible disease. I would much rather have an allergic reaction, if I was going to have one, than to be intubated and be unable to breathe and maybe even die in a couple of days. So, Anne Marie, it is a serious disease. You're right about half of the people, according to CDC data that's recently been shown, that may be asymptomatic. And what does that mean? It means that they have no symptoms, that they're spreading the virus and they're not wearing a mask. And you're getting that if you're riding a bus or a train or a plane with them, you can be infected and you can be severely affected and become ill quickly. So it's not a joke. And the vaccine side effects are minor. Joint pain, headache. I expect to have some muscle ache, some fatigue. I'm prepared for that. That's why I'm getting my second shot today, 21 days after the first, and I'm preparing for the long weekend of maybe a little soreness.
Dr. Bob, one question that I have is, can you decide which vaccine that you receive? In other words, when it's our turn, like mine and Anne-Marie's, to finally get the vaccine, which I'm guessing is not until probably the spring or the summer. But once that happens, can we say which one that we want or not?
I don't think you need to do that. And I'll tell you why. First of all, you'll probably be vaccinated before the summer. I would hope that you and Anne-Marie will get vaccinated within the next 30 days, if possible.
Okay.
We're moving pretty fast. We're moving fast now, Vlad. And we want everybody vaccinated. And there's a reason, a health reason for that. And that is to try to get to herd immunity as soon as we can, certainly by the fall, which will require 60 to 70 to 80% of the population to be vaccinated and to be immune. So the Moderna vaccine actually consists of about 3 times the amount of messenger RNA that the Pfizer vaccine has. And that's why people have been talking about halving the volume and actually splitting the dose, which is more than enough messenger RNA to give you. Because let's say there's 100 micrograms in the Moderna vaccine and 33 micrograms in the Pfizer vaccine. So nevertheless, there's enough messenger RNA to go around for everybody. So you shouldn't be worried about which one you get. The important thing for everybody to know is that if you get a Pfizer, you should get the second shot as a Pfizer. If you got a Moderna, you should get the second shot as a Moderna. That's okay. And if you don't do that, there's no problem really in the grand scheme of things, except it creates a little confusion. Because remember, the messenger RNA, the difference between the two vaccines is the nanoparticle, the amount of protein and fat that surrounds the messenger RNA molecule. I hope I make that clear.
pretty clear
Oh,
for those of us who aren't
dig
doctors.
back into my biology notebooks from high school. But we appreciate it. Listen, speaking of biology, you know, we have learned now about a couple of variants of the coronavirus, one coming out of the UK, one coming out of South Africa that also popped up in Brazil. We know that at least the one from the UK is here in the US as well. People want to know if the vaccines that have been approved of here in the US, will they also counter these new variations?
Yes, Anne-Marie, not to worry about that. These vaccines will cover these variants, and I say that with assuredness. The reason is that when you get the vaccine, you have a robust immune response that covers most of the variants, and you have a big T-cell response. Everybody's talking about antibody, but nobody's really talking about the tremendous T-cell or thymus-derived lymphocyte response that's very important to viral infections in general. So that's important. What may be affected by the variants, according to Dr. Fauci's latest comments, is the monoclonal antibody that is directed against certain parts of the spike protein. And that may be making that monoclonal antibody somewhat less effective. But I am assured by the experts at the CDC that the virus actually is very responsive to the products of the vaccine. Now, is it going to change over the many years to come? Perhaps. But look at the influenza vaccine. Every year we get a different vaccine with a little bit of tweaking. And I'm sure that both Pfizer, Moderna, and the other companies are going to tweak this vaccine so that it is totally protective for all of us going forward around the world.
So to the point that you make there about the flu vaccine, Dr. Bob, I know that correct me if I'm wrong, but the flu vaccines that we receive every year are not as effective as these vaccines for COVID-19 have proven to be, at least in the clinical trials. But I get it every year, and I'm just thinking back, I've never gotten the flu. So does that mean that I've been protected by the vaccine? Does it mean that I've never come into contact with somebody with the flu? And I'm trying to understand, if you get vaccinated for COVID-19, even if it is 90 or 95% effective in preventing you from being infected with COVID-19, could you still be infected? But my guess is that since I never have gotten the flu, because I feel like it's because I get the vaccine every year, that with the high efficacy rate of this COVID-19 vaccine, we should be in pretty good shape.
We should be in good shape, Vlad, and you're absolutely right. The flu vaccine is about 40 to 50% effective. The fact that you haven't gotten the flu, or even if you did get the flu, it may have been very mild, so you didn't think of it. You might have thought of it as a cold. This vaccine for COVID-19 is extremely effective, greater than 94%. Could you get COVID or coronavirus after this? You probably could, but it would be very mild, similar to the way that the flu vaccine prevents you from getting a severe case of the flu. Now, if it's 94% effective, that means 6% of the population could well be infected. But the infection, in all likelihood, is not going to be fatal. It may just be a mild case. Now, many young people get the COVID-19 infection and have very few symptoms, and within 3 to 4 days are up and around without fever, without aches and pains. That's a robust immune response. That's what the elderly and those with comorbidities don't have. That's why we're going after them as well as healthcare workers right now.
All right, Dr. Bob Lahita, some great advice, great analysis for us going into the weekend. We appreciate it as always.
Thank you.